Omaha's news leader, chronicling the stories and people making a difference in our community. This is KETV Newswatch 7's Chronicle.
Did you know heart disease is the leading cause of death for men and women in the United States? Good morning, I'm Rob McCartney. It is. And did you know one person dies every 33 seconds in the United States from cardiovascular disease? In Douglas County, kills 700 people a year. It is the second leading cause of death following all cancers. So today on Chronicle, we're going to talk with a medical expert about why preventing heart disease is vital year-round. And we're going to hear from a woman who barely survived a blood clot that attacked her lungs, then encased 90% of her heart. But first, just what is heart disease? Well, cardiovascular disease includes all diseases of the heart and blood vessels. Most common type of heart disease in the United States is coronary artery disease. It affects the blood flow to the heart, and of course, decreased blood flow can cause a heart attack. Now, several medical conditions and lifestyle choices can also put people at a higher risk for heart disease, things like diabetes, obesity, unhealthy diet, an inactive lifestyle, and excessive alcohol use. But my first guest didn't suffer from any of those conditions. In fact, healthy, active mom of two, yet she still suffered one of the biggest heart health threats. I want to welcome Nicole Schluter. Nicole, I'm so glad you're with us today because there was a chance you weren't going to be with us.
That's right.
You're coming up on a 5-year anniversary of a terrifying incident. Tell me what happened.
Yeah, it was a normal work day for me. I was going to work. When I got to work, I climbed a flight of stairs and I, kind of felt some short of breath, more so. My heart rate was elevated, just felt kind of lousy all day. I went home that night and it just kind of hit me like a ton of bricks and I couldn't breathe. Prior to that, I had a couple weeks of symptoms of leg cramps in my legs. I brushed it off as maybe it was just, exercising too much, or, maybe I didn't stretch after my workout, or maybe I didn't even drink enough water that day. And then I even woke up one night with some night sweats, which was another factor that is a sign of blood clots. But I wasn't thinking about those things. It was really the sharp pressure, the pain, and I couldn't breathe. That's what sent me to the emergency department that day.
Was it unusual? Had you had these symptoms before, anything like this?
No, this was out of the blue. I was, like you said, a very healthy, no health problems, nothing at all. So for me to go in, I knew something was wrong at that point.
Right. And so you go to the ER, the emergency department. What happens then?
They could see right away that I was in distress, like I wasn't breathing, properly. They sent me into imaging, and before I knew it, I was getting transferred to Methodist main campus, and they said I was going to have a procedure done. They did say, you kind of have a little bit of an issue. They kept me very calm. I didn't know the full extent of really what was going on, or maybe my mind wasn't going there. I think I was just worried about getting my kids. They were at different places and I was in the emergency department, and I was just like, okay, we'll go there. We'll see what happens. Before I knew it, when I got there, I went straight in to surgery for a procedure.
So a little bit of an issue turned out to be what? I mean, I understand this clot was rather large.
Yes. And I didn't know the extent of that, correct. But yeah, I got to main campus. Dr. Tlinkdart, he met me at the door. The surgical team met me at the door. And I was no time to think about it, which was probably good.
Sure.
No time to think about it. And before I knew it, I was getting a procedure done to bust up the blood clot that was encasing my heart. But I didn't fully know the extent of how serious it was until after the fact.
So tell me about how big this clot was. You say encasing my heart. That's a terrifying phrase right there.
I'm so glad he did not know that beforehand. I think I would have been more of in a panic situation, Everyone was so good about keeping me calm and collective. And like I said, I was worried about my kids getting home from their activities and needing to be where they were. And yes, after the fact, when I found out the seriousness of it, it was was scary, and how could this happen to me? Like,
Right. We had heard that it was basically or the width of a volleyball.
yes, yeah.
It's hard to fathom. I mean, so it started out as what, a blood clot in your leg?
It was in my leg, and just a piece of it broke off, and not the whole entire thing. So just a piece of it broke off and traveled to my lung areas, which was causing me not to be able to breathe.
Okay. So you had the procedure. Then what happened? I mean, what's your recovery? Were you out of the hospital like in weeks, months? What?
Actually, just 4 days.
Okay.
Yep.
Wow.
And I came home, and I followed up with additional imaging to see what the damage was to my heart, different blood work, trying to figure out, how did this happen? Why did this happen to me?
Right.
So yeah, it wasn't, I mean, I had to take it easy. I still had a blood clot still left in my leg.
Okay.
And I was put on then blood thinners to help dissolve that. And going through months of blood draws, trying to figure out, why did this happen, in and out of doctor's offices, getting my heart checked to see if there was any underlying damage that this caused. And thankfully there wasn't. Super lucky in that aspect as well.
Well, you look amazing. I mean, I wouldn't be able to tell you had such a close call.
Yeah.
That seems to be rather remarkable, is it not?
Yeah, it is. I mean, I was back to work a week later. I mean,
Wow.
yes, and my employers were like, "Are you sure you need to be back here?"
Right.
And I think I just wanted to get back to normal. But I didn't feel bad. It was gone. I felt much better.
Huh.
Truly miracle.
Is there any concern this might happen to your kids? I mean, is there any chance this is like genetic?
I went through all the blood testing, and it's not. There's no history in my family with it. I'm still going to be super conscious of it. Obviously, when my kids are a little bit older, and their pediatricians know about this incident. As far as I know, it was basically caused from oral contraceptive, like birth control pills.
Really? I've never heard of that happening. Interesting. So you're sharing your story today, which is great, and I appreciate you doing it. How important is it to you to share your story?
It's absolutely very important. If this helps just one person, I mean, don't ignore the symptoms, the signs. It's easy to say, "Oh, I'll deal with that tomorrow." If it's persistent, if it's something that just doesn't feel right, at least call into the doctor and say, "Hey, should I be concerned about this symptom? Should I be?" Take advantage of your smartwatch. I use mine all the time. There's health features on here that will show you if your heart rate's elevated, if your numbers look wrong. Just take an overall picture of how you feel, and if you're not feeling well for a couple of days and you can't explain it, I really hope people go and get checked out.
And don't be stubborn and avoid the emergency room, right?
It's okay. It's better to be safe than, sorry,
And to be here.
Yes, and to be here. Absolutely.
Nicole, thanks so much. And it is good seeing you.
Yes, thank you.
All right, so coming up a little bit later in the show, we're actually going to hear from the vascular surgeon who helped save Nicole's life, and his message for everyone out there who thinks, well, this can't happen to me. We all know that CPR saves lives, but did you know children as young as 9 can effectively give CPR, and that most cardiac arrests can take place at home? Well, we want you to know that it's easy to get certified. The Red Cross offers classes online and in person, and it's worth the cost to save a life, right? You never know. You may need someone to save yours. Just go to redcross.org for more information. It's important also to know what to do in case of cardiac emergency. First thing you should do, of course, call 911. That's exactly what Farrah Adams did when her 44-year-old husband collapsed in Lincoln. Farrah is an occupational therapy assistant, but this was the first time she ever performed the life-saving procedure. Dispatcher Joey Mims calmly walked her through CPR. Her husband, Des Moines Adams, was able to respond after a few minutes of compressions just before paramedics arrived. Well, last month, we reunited Des Moines and Farrah with Mims for a big thank you.
Appreciate so much everything that you did, your calm demeanor and your instructions were just such a relief in a time of panic.
I am well and alive.
Awesome. That's beautiful.
Yeah. So I just appreciate you.
Yeah, it turned out to be a small blood clot on Des Moines' lungs, which is now being treated with medication. In April, an Omaha man collapsed at the Dallas airport. Dana Caudle and his wife were returning from their trip to Mexico. In baggage claim, he started feeling a little dizzy, and he was basically dead before he hit the floor. One of Caudle's arteries was 95% blocked. 2 nurses, 2 EMTs, and a security guard all rushed to him, performed CPR, and used a defibrillator. Without them, he would have been dead at just 50 years old.
They worked as a team to bring me back from death. Luckily, because of these strangers that knew CPR, they were able to bring me back.
Since then, Dana has made some changes in his lifestyle. He's lost 60 pounds. Says he's looking forward to watching more sunsets with his wife. Certainly admirable. And here's another case. Last June, Greg Schrader was on a social bike ride with a group that he knew. What he didn't know, that day they were about to save his life. It was hot out while their group was riding, and they stopped to take a break at Crescent Moon in Blackstone. Greg says right when he reached the table, it was lights out for him. Luckily for him, his pack was all trained in CPR. They performed it on him for more than 10 minutes. Paramedics swooped in with an AED. They shocked Greg's heart and took him away in an ambulance.
According to my cardiologist, you guys nailed it. Said that you pretty much had the dream team. Had the dream team around you when it happened.
Well, Greg made a miraculous recovery. He was back on his bike within months. Here's a stat for you. Outside of a hospital, the chance of you surviving cardiac arrest, it's about 10%. But Greg found out later his chance of survival was only 3%. Some lucky people there, but also lucky because they had trained people around them. And next year on KETV News Watch 7's Chronicle, we're going to sit down with the vascular surgeon who broke up the blood clot surrounding Nicole Schleuder's heart, helping save her life. And later, siblings with a special bond. How these 2 brave brothers are dealing with the same heart disease. We're going to sit down with their mom, who says its rarity is what makes it so terrifying.